Throat cancer types and stages. Throat cancer occurs when cells grow in an uncontrolled way in part of the throat. Treatment is possible, but the outlook will depend on where cancer starts and how soon a person receives a diagnosis. Throat cancer can affect the larynx or voice box and either the upper or lower part of the pharynx or throat. As cancer spreads, it may grow into nearby tissues. However, the name of the cancer will always depend on where it starts. The National Cancer Institute classifies throat cancer as a head and neck cancer. It shares some features with oropharyngeal cancer and mouth cancer. It can affect both adults and children. In adults, exposure to tobacco and the human papillomavirus or HPV increases the risk of developing throat cancer. This video will look at some common symptoms, types, and stages of throat cancer. Symptoms. There are several different types of throat cancer and many places within the throat where cancer can develop. The symptoms and progression will depend on the type and location of the cancer. Common early symptoms of throat cancer might include pain or difficulty when swallowing, ear pain, a lump in the neck or throat, a persistent sore throat or cough, voice changes, especially hoarseness or not speaking clearly, swollen lymph nodes. A person with cancer in the lower part of the throat or hypopharynx may not have symptoms in the early stages. This can make it harder to spot. Other conditions can cause these symptoms. However, if they persist or are severe, a person should ask a doctor to check them to rule out a serious condition. Types. There are many parts within the pharynx, the tube that extends from the back of the mouth to the windpipe, and the larynx, the part of the throat that contains the voice box. Cancer can develop in any of these areas. Pharyngeal cancers. Nasopharyngeal cancer. This type affects the top part of the pharynx, in the area behind the nose. Oropharyngeal cancer. This type affects the back of the mouth and middle part of the pharynx. This can include the tonsils, base of the tongue, and soft palate. This is the most common type of pharyngeal cancer. Hypopharyngeal cancer. This type affects the lower part of the pharynx. Laryngeal cancers. Cancer can develop in any area of the larynx, including supraglottis, the area of the larynx above the vocal cords that includes the epiglottis. Glottis, the middle area of the larynx that contains the vocal cords. Subglottis, the lowest area of the larynx extending from the vocal cords to the windpipe. The National Cancer Institute explains that throat cancer often begins as squamous cell carcinoma. This means cancer starts in the squamous cells that line the throat. The institute adds that this type of cancer can also start behind the nose or in the mouth. Staging. Staging gives an idea of how far cancer has spread. Staging for throat cancer will depend on the type. For throat cancer, doctors will typically describe cancer stages in these categories. Stage 0. Abnormal cells have formed that have the potential to become cancerous. Stage 1. The tumor is smaller than 2 centimeters and has not spread to the lymph nodes. Stage 2. The tumor is between 2 cm to 4 cm has not spread to the lymph nodes. Stage 3. The tumor is larger than 4 cm or has spread to a small nearby lymph node. Stage 4. Cancer has spread to nearby tissue, to larger or more distant lymph nodes, or to other parts of the body such as the lungs. The grade of the cancer also affects treatment and outlook. A high-grade cancer is more aggressive than a low-grade one, meaning it is more likely to grow quickly. When a doctor knows the stage and grade of the cancer, they will talk with the individual about their treatment options. The survival rate for throat cancer depends on the stage of cancer, the type and where it occurs. Experts use past statistics to calculate a 5-year relative survival rate, which is an estimate of the likelihood a person will live at least another 5 years after a cancer diagnosis. The American Cancer Society provides 5-year relative survival rates based on information from the SEER database, which the National Cancer Institute maintains. When evaluating all SEER stages combined, the American Cancer Society offers these 5-year relative survival rates of people diagnosed with throat cancer between 2010 to 2016. Here you can see the table on the screen. Type of throat cancer, 5-year relative survival rate, all stages combined. Laryngeal supraglottis 46%, laryngeal glottis 76%, laryngeal subglottis 52%, hypopharyngeal 32%. It is important to note that these estimates do not indicate a person's individual outlook. Researchers also may have developed new treatments since the time when studies collected this data. A person's doctor will evaluate their specific outlook in the context of their diagnosis, medical history, and treatment plan.